Hello, my name is Dr. Mugambi Jacqueline Wanjiku. I'm an OB gynecologist and also a Hifu specialist. Today I'm going to discuss what Hifu entails. Hifu stands for High Intensity Focused Ultrasound. It's a non-invasive ablative technology where we use ultrasound sound waves to burn off this fibroid or adenomyotic tissue. So the low intensity sound waves that come from the ultrasound are directed through your abdomen to where the fibroid is, and where the ultrasound waves convert that energy into thermal energy to almost 60 degrees, killing off that fibroid through an irreversible coagulative necrosis process. So with time you notice that your fibroids start shrinking and you have symptomatic relief like reduced heavy blood flow and decreased pain or cramping. So what do we do? The 3 steps that we do prior to having Hifu done. So we must have a consultation and a review. During the consultation we do a proper history taken, a thorough physical exam and a pelvic examination. And if the patient has come with a pelvic MRI or a pelvic ultrasound, we review it and go through the process of Hifu and having a treatment analysis done. If the patient had not done an MRI, we request for one, a pelvic MRI with contrast. An MRI is usually more detailed and more specific in identifying these fibroids and helps us to make a treatment analysis so that we ensure that the surrounding structures during the Hifu procedure are not damaged. After that is done, we do what we call a simulation. A simulation entails having to use this machine that is behind me. It's called the JC300 Hifu machine, where we simulate how the procedure will go and we see if we can be able to create a safe pathway where this energy can go through the abdomen to the fibroid and cause the ablative necrosis to happen. Once the simulation is done and the patient has met the eligibility criteria, we do now the procedure. Prior to the procedure, a patient must have a 3-day bowel preparation. The purpose of this bowel preparation is to make sure that you can be able to get a safe pathway away from the intestine so that you don't have any gut injury. And since it's a real-time imaging, I can direct that energy directly to where that fibroid is. So you do a 3-day bowel preparation, and we do some medication that we give you to make sure that your electrolytes are within normal prior to the day of the procedure. And the day you come, I can show you the machine. So on the day of the procedure, the Hifu procedure, the patient will be reviewed also by the anesthetist and also the nurse. We give sedative medication so that the patient is semi-conscious to be able to communicate during the procedure. The patient will lie prone on this bed. It means the head will be here, the tummy will be here while facing down, and the legs will be on this side. I use this, it's called a balloon, which we place it between the probe and the patient's abdomen so that I can be able to create a safe acoustic pathway using this and be able to move the intestine and gut away from the energy pathway. So inside here, I want to show you where the probe is. This is the probe where the ultrasound energy will be coming from. The energy will come in an angle towards the abdomen to where the fibroid is, and at the point where the energy converges, it will convert that energy into thermal energy to about 60 degrees and burning off this fibroid. Normally it takes about 2 hours to have the procedure done. This depends on how the blood supply is to that fibroid and how big those fibroids are. After the procedure is done, we do what we call bladder cooling to ensure that there is no more heat or sensation or burning sensation in the abdominal area, and we take you to the resting area where you rest for about 2 hours and you get to go home. So what are some of the advantages of having Hifu done? Number one, as I mentioned, it's a non-invasive technology. It means I'm not going to have to cut you, no blood loss. It's a day case where you come in the morning, you have the procedure done, and by afternoon you go home. You get to return to your daily activities as fast as possible. I maintain your uterus as it is and the integrity without having to interfere with fertility. So where can you find us? We are located at Landmark Plaza, first floor, Awikodet Road, opposite Nairobi Hospital. Thank you.